Good morning, everybody. Jason from Cutting Edge Physical Therapy. Glad to be with you here. I hope we have some people who are watching this morning. I decided to do this new video based upon some evidence that I'm seeing over and over and over again when people ask me, what should they do for their low back pain? What exercises should I do for my low back pain? Well, one of my biggest pet peeves is not with people really asking that question, because it's a very appropriate question for a physical therapist, but the fact that people go to YouTube and Google what exercises I should do for my low back pain or for my sciatica. That is the absolute worst thing you can possibly do. That is my biggest pet peeve, because without a proper assessment of the patient, it is impossible to determine what exercise might be helpful for you. So what we're going to do in the video today is just some self techniques to look at to see if you are able to help yourself right away when you have acute low back pain. All right, even if you have chronic low back pain, this is something that you can take yourself through to see that it might be helpful. Now, just a couple of statistics. Number one, the prevalence of low back pain within the United States is 40%. So that means that 40% of people at some point are going to have low back pain. So this is a huge problem, multi-billion-dollar problem. In fact, there's upwards of $300 billion spent on back pain or back care in general. And the likelihood that you're going to have back pain again is very high. So if people have a back injury, the likelihood down the road that you're going to have back pain is significant. So don't just blow this off and think, it's not that big a deal, because we've all had back tweaks here and there, but you'll notice that they may become more frequent and more intense as you go along the lines if you don't care for yourself properly. So that's going to be very important. Now I'm going to show you a couple things in a book here. And Jace is being nice to be a cameraman today, and we're going to show this book right here. This is a book called Treat Your Own Back. It was done by a physical therapist from New Zealand named McKenzie, who is one of the most influential physical therapists in the world. And he wrote this back book specific for people to treat themselves. And this method, called the McKenzie Method, is what we use with all of our patients that come in here. It is an assessment tool to treat joint-related pain. And we do that with every joint, not just the spine. But I want to show you a couple things in this book here. A lot of people have injuries. Sorry, I'll get it here, Jace. Have injuries. Whoops. And this are some of the injuries that people have here. Notice how people are bending forward, lifting, getting into their trunk, twisting. Those are the most common ways that people injure their back. In a flexed position, and often flexed and rotated. That's really where you can get into trouble. So these are some of the ways that people get into trouble. I can go into a bunch of different things, but that's pretty specific right there. Now, also in this book, and by the way, you can buy this book on Amazon for like $9. Just take a look at this. But in this book, there's this little checklist to see if you're actually appropriate for mechanical therapy. In fact, I've started calling myself a mechanical therapist rather than a physical therapist, because really we're looking at mechanics and how people move. But this checklist can actually tell you whether or not you might be appropriate for some of our activities. Now, what does people's pain look like? So this slide over here is how people's pain typically looks. We see back pain, which can go all the way across. It can be central, right in the middle. It also can go to the buttocks. It can also go all the way down the legs. Sometimes people talk about numbness, tingling, burning, aching, sometimes weakness or dragging their leg. Those are all problems. Now, if you look at this here, you notice that the pain, as it goes down, increases and goes down the leg. The further the problem goes down the leg, the worse the problem is, all right? The closer it gets to the spine, the better off you are. So if you're doing activities or exercises that's creating leg pain that goes all the way down, that's a worsening symptom. If you create movements or exercises that bring the pain up out of the leg more towards your back, even if it's more intense, it is an improving symptom. So this is a really great slide to look at. for this picture to tell you what's going on. And what we want to do is anytime you have sciatic pain specifically, we want to move it towards the central aspect of your back. So a lot of times when we do movements, we hear people say, oh, it's not in my calf anymore, it's not in my thigh, it's not in my buttocks. Those are good moving signs of a theory called centralization, which we see every single day in the clinic. So this is a really great picture here. Now, the first thing I'm going to do with you is just to tell you, if you have acute back pain, what are the positions you can get into that are most comfortable? So I'm going to show you two positions. You can choose either. But listen, the research does not show laying down for 3 or 5 days is the answer anymore. Actually, movement is good for the body and the joints. So maybe 24 hours max, but we don't recommend bed rest anymore. 25 years ago when I first started, everybody was on bed rest for a week. That's a horrible idea, and research does not back that. So let's talk. I'm going to bring Jolie in here because we're going to show two positions that will be helpful for an emergency low back position. So Jolie, come on in. Let's have you lie flat on your belly, feet off the edge here. Okay, so slide up just a little bit, just so your feet are off the edge. Good. Okay, so we've put Jolie in a prone position. This is obviously one of two emergency back positions in case you get in trouble. Acute related back pain, okay? You're out weed eating the lawn and you twist and you hurt. This is one position. All we're gonna ask her to do is 5 minutes or so of laying flat like this. Nice, deep, regular breathing, just in and out. I always tell patients, go to Hawaii and just kind of relax in your mind. But just relax and breathe nice and regular here. That's number one, all right? Now, if this increases your back pain or increases leg pain, then you're going to want to get out of this position, all right? The best way to do this is off the edge of your bed. So you're going to have your feet off the edge of your bed. I often tell people to go at the foot of the bed. The foot of the bed is the firmest part of your bed. You know, if you put yourself in the middle, you may sag down in. Sometimes propping a little pillow underneath the abdominal area to help bring her up into a more neutral position for the spine is helpful as well. So you can try some different modifications of that. Now the second position, let's go ahead and have you roll onto your back, would be her lying on the ground, and then, go ahead and bend your feet up. Good. Would be to bring her feet up like this, okay, relax, okay, onto the couch. And you see a lot of people do that. That's the second best position. The first, I would always tell people to go to their belly. I know that sounds crazy, but this is the next best position. And again, we're only staying here for 5 or 10 minutes max. We're not doing this over and, you know, for hours at a time. Bad news, bad news, bad news. All right, so just a couple of minutes in this position. The other thing with acute pain, people always ask us, should I use ice or heat? You should always, always use ice for the first 24 to 72 hours. And the reason for that is if you've injured a tissue, you're gonna have swelling, bleeding, inflammation. Those are always taken care of by ice more so than heat. Heat can often get you into trouble. So I would not use that for at least the first 3 days, all right? So those are the emergency positions for the back. By the way, if you have any questions during the video, go ahead and send it in and I'll try to answer those when I review the video or the comments on anything. Tell me where you're watching from, and also if you have anything that you really want me to address, I'll certainly address that. And we'll give you a couple of minutes at the end, and I'll give you a free offer at the end of this whole video, so just be aware to stay tuned. All right, so the next thing we're gonna look at, we're gonna have Jolie stand up. Okay. The next thing that we're gonna do is we're actually gonna look at Jolie's posture. So the first thing you can do is look at your posture in the mirror. Do I look upright? And she looks pretty good here. She's got a normal curve here in the low back, normal curve here in the mid back like this. And also, let's go ahead and turn you towards me. Okay. We're also gonna look at her spine up and down. Is it straight up and down? Okay. Now, I want to tell you one thing. If you look all nice and normal, fantastic. Then you most likely can treat yourself. That's the good news. You might need our help to guide you a little bit. But if you wake up one day and you are shifted, and I'm going to put you in a shift here, so just shift like this. Okay. If you look like this, and you weren't like that before, you didn't have a scoliotic curve or anything like this, this is called a lateral shift. this needs physical therapist intervention, all right? You call if you wake up like this the first day, you need to call our office right away and get in as soon as we can see you, okay? Because this is a big problem. Lateral shifting usually is related to a disc problem, and that needs to be taken care of. That's not comfortable, is it? No, it's not comfortable at all. Because this typically requires our hands to help you get straight up and down again, all right? So, now, the next thing, go ahead and sit right here for me. Okay. The next thing I want you to look at when you're having pain is what happens with postural correction. And postural correction is very simple. Most of us sit like this, right? Every time you look at your computer, every time you're on your phone, every time you're sitting at dinner, right? Okay. So assess what your back pain or leg pain feels like. Then what I want you to do is I want you to sit up really tall, really, really, really tall. Come on. Good. Now, come back just a little bit right there, okay? So you pull yourself up into really, really good posture, and then you let yourself relax, okay? Now, again, assess. Is my back pain better? Is it worse? Is it no different? Has my leg changed if you have sciatic pain? A lot of times we correct people's posture, and the leg pain actually goes away, all right? So simple things like that. And we'll talk a little bit about using maybe a lumbar roll when you're sitting in just a couple of minutes as to whether or not that might be helpful for you or not. Is that helpful for you? Can you sit? Yeah. So again, slouch. Oh, that kills my back. Up all the way and then back just a little bit. That's the comfortable position. Okay, and parents, by the way, if you bring your kid in and tell me to tell them to correct their posture, I will not tell them that because they won't do it. And what we need to do is teach people to just get out of those slouchy postures every once in a while. Postural correction is here. No exercise fixes posture, ever. If someone tells you that, it's just not true, okay? Now, the other thing I want to touch base on is the reason why we do this assessment like this is because x-rays make mistakes. MRIs, 52% of the time, do not tell us what the problem is in your back. 52% of the time, you just paid for a $2,000 test, and half the time it will not tell you what's wrong. And clinicians make mistakes. I make mistakes, and we try to correct those as we go along. And doctors make mistakes, therapists make mistakes, we all make mistakes. But your symptoms will not make a mistake. So if we listen to your body and your symptoms and move in the appropriate direction, you're going to get better, all right? So that's really important to understand. Okay, now go ahead and stand up. Now the next thing we want to look at with a patient and you at home is do this. First thing I'm going to have you do is look at your motion. Your back moves forward, backwards, and from side to side. So let's look at bending forward. So keeping your knees nice and straight, I want you to reach down forward like you're going to touch your toes. Now obviously Jolie is extraordinarily flexible, okay? And she can do this. So come on back up. So that's no problem, right?
No.
Okay. And a couple of things that we look for is, did she move smoothly forward and back? Some people go down and next thing you know, they're climbing back up. That tells us that maybe flexion wasn't the right position for them, okay? Now the next thing, and she had full flexion. But a lot of times people come in and they'll bend forward and they'll go, oh, it's right there. Hits them right there, hits in the low back or hits in their leg, okay? Now the next movement we're going to do, we're going to take your fingers, we're going to put them right in your back like this, okay? And then you're going to lean back as far as you can. Further, 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 further. Okay. Good, relax, okay. Now, is that any problem?
Yeah,
that hurts, okay. So that hurts Jolie, which has hurt her for a long time. Extension has kind of been problematic. But we're looking at quality of motion. She should probably, at her age, be able to go further than what she's doing right now. But ask her how many press-ups she's done today. None.
No.
She's done none. Okay, so the next movement, and we're going to have you face the camera, okay? And widen up your feet for me, okay? Hands on your hips. And then what you're gonna do is, I'm gonna come in front of you so I can show you what I want you to do. And then what you're gonna do is you're gonna look at how the movement feels when you slide your hips to one side, and then come back and then slide your hips to the other side. Go as far as you can each time. Go further, 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 further. Good, relax. And then the other way, further, 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 further. Good, relax. Any problem going either way there? No, okay. And that looked pretty good. She looked clear going back and forth, okay? So, turn this way again. So what we have is we have no problem going forward, pain going backwards, but only at end range, right?
Yeah.
It didn't hurt while you're doing it, but when you get all the way back here, it's uncomfortable. And then when you stop, it was no problem, right?
Correct.
Okay. So now what we're gonna do is ask yourself what's going on with your pain. I have back pain and I have leg pain, or I just have leg pain, or whatever it happens to be. But then what you're going to do is you're going to test yourself in repeated movements. We don't move our back once a day. We move it thousands of times a day. So to think I can develop a program based upon one movement is idiotic. It just doesn't make any sense. So what I'm going to ask Jolie to do, and what I ask my patients to do, is think about your back pain, think about where it's located, get a mental image. And then what I want you to do is I'm going to ask you to bend forward 10 times. So right now, you're going to go ahead and bend forward 10 times. And as you're doing this, ask yourself, what is happening to my back pain or leg pain as I do this? If it's coming up your leg and getting better and coming closer to your back, you're doing the right thing. If this produces pain that goes down the leg or increases or develops more intensity, that's a problem. That's an exercise you probably shouldn't do. Okay, did you have any problems doing that? No problem. Okay, very good. So in this sense, Jolie had no problem moving forward, but you need to look at that and see what happens. Now, the second exercise, I always tell people to get up against their kitchen counter. So move your butt right there. Okay, now, again, here, all right, no back pain right now.
No.
Right, okay. So now what I want you to do is go backwards as far as you can and relax and do that 10 times. Okay, so we've moved forward and backwards. What happens as you get back there every time?
It hurts.
Hurts every time you go back, and then when you relax,
It's better.
it doesn't. It goes away.
Mm-hmm.
So this is what we call producing the pain, no worse. She's coming back. It's not making it any worse. Okay, good. Relax. All right. So that's another movement. And again, ask yourself the question: what happened to your back pain? Did it make my leg worse? Did it increase my back pain? Did it spread it out? Did it bring it closer to the spine? Remember, we talked in the beginning, if it's coming out of the legs and more towards your back or from the back in towards the center, you're doing the right thing. All right? That's really important. Must understand that. So now, face the camera here. Now, put your hands on your hips. Widen your feet out. Now, not the only time, but we may move lateral as well if you feel like one side is limited when you're moving side to side. This is typically only with people who have one-sided back pain. So left low back pain with left sciatic pain, then sometimes you have to move from side to side. Not all the time though, okay? And all you would do, it's really important, that if you have pain on this side, you will typically move your hips to the opposite side. So if she had left-sided low back pain or left sciatic pain and forward and backward bothers her, then we might need to look at moving to the side. But typically, we move the hips away from the side of the pain. Okay, relax. And then when you do this, you don't come back this way. Okay? You start here, and you move this way and come back. All right? If you likely need to do this, you should probably see us. All right? This is more tricky. It's a little bit difficult to guide you through in just a video like this, so just keep that in mind. Now, all right, let's look at some other movements. We're gonna come down here and lie on your back for me. Let's say that while we did the standing exercises, this hurt and this hurt. Did not make her any better, worsening symptoms down the leg. Then we can look at what happens when you lie down. Bend both knees up. Oh, just foot feet flat. This is the position you're gonna start in. I tell people to start on the firmest surface. So the firmest surface is the floor. It's the floor, okay? As long as you can get up and down there, all right? Now, again, we reassess. Where's your back pain? Where's your leg pain? What's happening? What's the intensity? Because if it changes when you lie down, then we need to have a new set of standards. First exercise is bringing the knees up to the chest. Pull up as far as you can. Pull, pull, pull. Does that feel okay? Yeah. She's fine with flexion. So repeated movements would look like this. Then back down to your starting position and do it again. So go ahead and do 10 while I talk. All right. Again, this is what we call repeated flexion in lying. You're bringing your knees up to your chest. This is no different than bending forward. This is one of the most common exercises I see on videos. Probably 1 out of 10 patients get this exercise initially, because we spend so much time bending and bending and being over the computer that often bending is not the answer to our back pain, all right? So this is one option. No trouble with that. And the other options is if she pulls up I can give her a little bit more. So if you have a spouse or somebody at home, if that feels good, reduces the back pain, reduces the leg pain, if it does. If this makes your leg pain worse, then you got to stop. Now, next exercise, we're going to flip over on your belly. And slide down just a little bit more. Perfect, right there. Okay, now again, remember, this was the emergency position. So if you like this position, this is one thing here. Our next step is to see what happens to your symptoms if you get up on your forearms. So prop up on your forearms, like this. There you go. So I just tell people, watch TV, like you're watching TV, okay? Now, you can see Jolie has a pretty good curve in her back here. Her years of cheerleading and gymnastic stuff and diving is really what kind of helps her flexibility. Now, how's that feel?
Tight.
Tight. Feels tight right in the center. Normal? Okay, that's normal. Because if I took your finger and bent it backwards, it would feel a little uncomfortable. It'd feel uncomfortable all around the ligaments here, so you're stretching stuff right there. But okay.
Yeah.
Okay. Again, what happens when you're in this position to your spinal pain? Does it radiate down the leg? Does it get worse? Or do you start to feel it moving this way? And again, oftentimes when it moves up, it gets more intense. I don't want you to be afraid of that. We want to get it out of the leg. Oftentimes we put people in this position when they're in the clinic for their first visit, and they already start to see the signs and symptoms of the pain creeping up the leg, going away down here. And then we also see things like improvement in their walking, improvement in their strength. So we take a lot of baseline testing. I didn't do that with Jolie because it's not something you would do at home. But again, what would happen if we put her in this position? Okay. Now, the next thing you can look at is relaxing all the way flat. Okay. Put your hands out to either side like you're going to do a push-up. Okay. I don't want you to do a push-up. Let's put these hands just a little bit right there. Okay. Now go ahead and do a press-up. Keep your hips on there. I just want to press all the way up, straighten out your arms. Good, beautiful. Okay, and back down. Does that bother you?
A little bit, yes.
And a little bit, is it pain or is it the strain?
It's pain.
Pain right in there. Okay, so she has a little bit of pain. Okay, so what I always ask patients to do is to do 10 of these. So go ahead and do nice and easy 10, and let's just see what happens after you do 10. So again, nice and easy, keep breathing as you do this. It's really important to not be afraid of this movement because this movement fixes 60 to 70% of our back pain patients and sciatic patients, with sometimes a little bit of tweaking here and there. So I just want you to be aware of that. But if you do one and you go, oh, it hurts, try 10, 20, or 30. Okay? How you doing?
Just standing.
Okay. Does anything change as you do that?
It's more centralized and it loosens up.
It's getting easier. Yeah. So a lot of times people are afraid to do this movement, but as they do 10, okay, you can relax now. As they do 10, 20, 30, it gets actually easier. So don't be afraid. And remember, we move our back thousands of times, and to move it just 1 or 2 times is not the answer. The movement is 10, 20, 30. And the thing that we don't know as therapists is when you come in, we could fix Jolie in 10 repetitions, or we could fix Jolie in 100 repetitions. This is like that old TV show, Name That Tune. I can fix this person in 10 repetitions, or I can fix this person in 6 repetitions. We don't know that number, unfortunately, so it might take 100, it might take 200, it might take a day of working through this to know. So go ahead and do another set of 10 for me. Okay. Still getting easier? Mm-hmm. Yeah. So for her, this might be something that she needs to do regularly because she has a little bit of pain at end range, but it gets easier as she does it more. That's a really great sign. Okay. Now to make this a little more intense, you're going to come up and lock your arms. Lock your arms. Inhale and blow it out and let this all sag. Feel that little extra stretch there? Good, relax. A lot of times people like that little bit of overpressure. Do that one more time. Lock. We call it lock, blow, sag. Okay? And relax right there. Good. Come back. Okay, relax. Okay. Now, she might feel a little bit of strain. There's a huge difference between strain and pain symptoms. Strain is I worked out, I felt stretched, I have muscle soreness. Those are normal, good things. And you need to define the difference between strain and pain. Pain is ouch, stabbing. You know, if I used a 0 to 10 scale, it's a 6 or a 7. And again, what happens to your symptoms as you do this? if it's coming out of the leg, I can't emphasize that enough. Come out of the leg, it's getting better, even if this is getting more intense. So be very, very aware of that. So the important thing here about all that we've done today is just look at repeated movements at home. That's how you determine what exercise you should do. And if you find that this exercise, or let's just say propping up on your elbows, oh my gosh, Jace, that takes care of all of my back pain. Great. Do this multiple times per day. That's the key. Listen, you cannot do this once a day. You have to do it every 2 to 3 hours. So whatever movement you find that either centralizes your back pain or decreases it, you must do it multiple times throughout the day. Every 2 to 3 hours is really, really, really important, okay? And the first thing we're going to ask you after you come in to see us is, did you do your exercises? And if you did your exercises, what were the results? Because that's really important for us to understand. If you go home and don't do the exercises, we didn't learn anything. So that's really, really important, all right? So exercise could be propping up. It could be the presses. It could be bringing your knees into your chest. Okay, go ahead and sit up for me. Go ahead and come down here and sit in the chair for me. The other thing it could be is come to the edge of the chair, widen your legs, put your hands on your knees, and lean forward as far as you can. Lean forward, stretch further. It could be repeated sitting or repeated flexion and sitting, which could be this as well. This might help as well. I see this help people who have trouble just walking, 5-10 feet and have both-sided leg pain. That's something called stenosis. This sometimes can help people as well. Now, the last thing that we want to talk about is correction of your posture, because especially if sitting upright really helps you. So slide your butt all the way back. These are called lumbar rolls. We recommend these. In fact, if you come in as a patient, I give these out for free as a patient. But we have these available. They're kind of squishy, feel them. Pretty squishy. Okay, so they squish down to support the low back. So we always recommend using a lumbar roll. Again, only in about 1 out of 10 people does this not feel comfortable. So the way you do this is make sure your butt is all the way back into the chair here, and then lean forward a little bit. And I kind of squish this down into her low back. Come on back now. So it fills up that spot. Now, how's that feel? Good. Okay. Yeah, that fits in like perfectly with her back. Now, one of the things I'm going to comment on is obviously this chair is not tall enough. This space really needs to be filled in. I usually take a towel roll and roll it up here so that her thoracic spine is also supported here. But most people feel comfortable with this. You need to get out of your lazy boy, out of your squishy couch. You need to be in a firm upright chair, wingback chair, kitchen chair, office chair, or even a rocking chair would be better, all right, to get you into this upright position. Get your back supported, all right? I often tell patients that bending is really the cause of a lot of their back pain. If we had a cut on the back of my knuckle and I kept bending my knuckle, what would happen? The cut would never heal. So what we do is we hold it like this for a while, let the cut heal, and then start bending again. The posture roll is just like that. It's helping hold things in a good position so it can heal, and then we can start moving normally again. Okay, so lumbar rolls. If you want a lumbar roll, you just come into the office. You can buy one. If you come in as a patient, I'm going to give you one if it's helpful for you. All right, so that's really important. You can also, if you don't have a lumbar roll, a small pillow helps. You can also take a towel and roll it up. Take your fingers and do just like this and roll up a towel about that big. And that usually fits in your lumbar spine. And you can take it out a little bit. You can put in more depending on what makes you feel better. All right, but you have to sit like this all the time. For the rest of your life, not necessarily. But for about the first 2 to 3 weeks that we're working with you to try and get your symptoms down, you've got to use one of these to help support your back. Now, that's really everything that we do here in the clinic, and that took me about 20-25 minutes or so. And we'll move you all around and we'll determine what movement makes you better, and then that's the movement we're going to do. We often only give patients one movement at a time. There's 2 reasons for that. Number 1, we want to see what happens. Number 2, I'm not smart enough to give you 5 exercises and figure out which one might be hurtful. Because you could do 4 exercises that feel great and one that's terrible, and it can ruin the whole thing. So we're going to look specifically for the movement that helps your back. Now, we're at the end of our video now, so if you have any comments, write your comments down as you watch the video or type them in, and then I can respond to them. You know, I always need that feedback interaction. If there's something else that you'd like me to talk about specifically with back pain, neck pain works in the same way. We can talk about that as well. But here's my offer to you. If you like, share, comment on this video, and you want to come in and get a free screen, you can come in and get a free screen. But you got to like, share, or comment on the video in order to get the free screen. And you can comment and then call into the office and ask for the free screen. And we'll go through just a couple of minutes of things here to see if we might be able to help you. Now, thank you. The only other thing I want to comment on is this book, okay? It's like $9 on Amazon. Please, I have people who have already read it before they come into my office. It's great. You understand the philosophy that we use and how we're going to try and help you. And Robert McKenzie was absolutely brilliant. You'll appreciate the story of just how he discovered how to do this over 60 years. And this is actually in the 10th edition of this book now, so it's been a bestseller. It has been great to be with you this morning. Again, comment, like, share, and you can get a free screen from me at any time. You just have to come in and get it scheduled and say, hey, I watched the Facebook Live or I watched our video, and then you can come in and get a free screen. It's been great being with you this morning. Thanks a lot. Remember, we are open during the pandemic, so you can come in at any time. We're ready to treat patients, and we'll be glad to see you. Have a great day.